Hi, this is Mark. I'm a psychiatric mental health nurse practitioner in the United States. I practice in the United States. I have a private practice with my wife and some other providers. We have two offices in the United States. I have some patients in other countries, some in South Africa, the country of my birth, some in Australia, some in Israel, some in Canada, but the main focus of the practice is in the United States. Because of this uncertainty in the world at this present time with COVID-19, the coronavirus, etc., I find myself being very, very concerned about not only my patients, of course not only my family members and my loved ones, but the first responders and the first line workers all over the country, particularly at this particular time, today being April the 5th of the East Coast, particularly New York City. I worry about issues that first responders, and when I say first responders, I mean all the people on the front lines taking care of patients, doctors, nurses, nurse practitioners, physician's assistants, EMT workers, firefighters, patrolmen, everybody who responds to calls and who treat people and help people. In my practice, I treat a lot of PTSD, post-traumatic stress disorder. In fact, when I see patients, I look for PTSD first. When I first started practicing, and I'm in my 11th year of practice, of course I would look at PTSD. It's one of the major items that we look at when we do assessments on patients. I would always look at PTSD and I would think to myself, I wonder what caused this, or I wonder what the underlying issues were. In the early years of my practice, maybe my first year or two, I would concentrate more on depression and anxiety and panic disorder and sleep disorder. Basically, not realizing that the key factor here was PTSD. And I will explain this some more, but the main issue that I am alluding to is that the people who are treating this virus, not only the people with the virus, but these first responders and these people responding to what is going on have PTSD. They may not realize it yet because they are still actively working. But some of them may even get this already when they go home, or they get brief moments when they're not inundated with patient care and incoming patients, or unfortunately, patients passing away. But I'm positive that they have PTSD. So what I used to do is, and being a prescriber, I have to think of terms of not only psychotherapy or what may be appropriate for a patient, but I also have to think of what type of medication will suit a patient. And I always used to look at depression or anxiety or sleep disorder or panic disorder. I used to look at those things. And then one day I woke up, thankfully, and I realized the way we have to deal with this is we have to look at this as if it was a pyramid. For example, we all know the shape of a pyramid. The base of the pyramid is PTSD, upon which we build depression, anxiety, sleep disorder, panic disorder. And when I say sleep disorder, I mean not only having difficulty falling asleep or staying asleep, I mean being woken up by nightmares of things that we may have seen. Maybe not directly of what we may have seen, but feeling that we are threatened or scared or afraid, or feeling that something bad is going to happen to us or our loved ones. Why this is all important is because we are so concentrated right now on the actual patients and on saving lives. We may not realize what's coming, not only for the patients that survive this, but for these people that are treating this virus too. They're almost certainly going to need care definitely for stress and anxiety. And if that builds up and it's too bad, it can develop into panic disorder, but definitely PTSD. The way I look at myself, and I'll give you some history here, I wanted to be a swimming coach, and my first degree was in sports science. And my intention was to join my South African swimming coach and expand his coach. I was going to go back to South Africa. But, and to paraphrase John Lennon here, which I do a lot, life is what happens when we're making other plans. So life intervened. I ended up staying in the United States. My coach ended up emigrating first to the United States and then to Canada. And I draw a lot on the coaching. I wanted to be a coach. Now I see myself as a coach of life, not so much as a swimming coach. That is what my coach taught me. He also taught me the reward for my coach was my success. My reward as a provider is the patient's success. That's what's important to me. I like to listen to patients. I don't judge them. I look at every patient that I see as a success, especially if when I first connect to that patient, they are down or they're struggling or they are having some kind of difficulty. And if I can make that feel better, that's the success. And if I can do something here to gain the attention of some of these first responders and some of these patients and some of these people who are suffering, that's the success for me. To me, my philosophy is always based on the swimming, and I always draw on swimming comparisons. To me, it is when I compare psychiatry to swimming or psychology to swimming, the main thing to me is that it's delayed gratification. Swimming is the ideal sport to realize that. You train a whole year to be able to swim one event or to swim one meet, and then you do it again. Now, the way I look at this is with psychiatry and psychology too, it's delayed gratification. You are always going to have issues. You're always going to have things come up. You're always going to take off layers of that onion, especially when you're dealing with PTSD. Going back to PTSD, this always needs to be worked. It always needs to be ongoing. It always needs to be dealt with. And what I think we will find with the people suffering from PTSD from this virus is a lot of them are going to realize that they had things that were bothering them before. For example, you have an ER nurse or you have an ER physician. They are seeing stuff now, but say it's somebody who's been practicing for 20 years, they're going to start realizing that these are things that they've been dealing with their entire lives. I have a friend who works in a hospital, and this person realized a few years ago that PTSD was the main issue that was bothering them, and to the point where they felt that they could not practice to the level that they wanted to practice anymore because of what they had seen for so many years as a first responder. Some interesting facts about psychiatry for me. First of all, we treat symptoms. Yes, I can call it PTSD. Yes, I can call it depression or anxiety, etc. Yes, I can call it bipolar disorder or schizophrenia or ADHD or TBI. I have to call it something because the medications that I prescribe have to be related to the diagnosis. That's just part of it. But, and this is always such an interesting fact to me, and I love taking students, and I take students a lot. I think I've taken about a dozen or more students in my time of practicing. But the interesting factor is that I probably see 67,000 patient encounters a year. And if I have 10 or 12 a year that the person actually says to me, so what do you think is wrong with me? What's going on here? What do you call this? What's my diagnosis? If I have 10 to 12 out of 6 or 7,000, that's a lot. People don't care. They don't care what it's called. They care that they have symptom relief. That's the key. Going back to PTSD, I'm almost certain that all these people who are suffering and hurting and working and to the point of exhaustion and beyond right now, they are not going to only need medication. That's part of the treatment. The other part of the treatment is psychotherapy. And I'm hoping that these hospitals and these areas are going to be setting up this type of care for these type of people immediately, because it's going to be needed immediately. This is how I always describe therapy and treatment for PTSD to my patients. I tell them it's like a football team. The offense of the team is the medication. The defense of the team is the therapy. You can have the best offense in the world, but if you don't have defense, you're going to probably lose. You can have the best defense in the world, but if you don't have any offense and you can't score any points, you're also going to lose. You have to have balance. There are some wonderful psychotherapy treatments now. EMDR comes to mind, CBT, DBT. These combined with medication therapy are probably what is needed. A couple of other things that interest me greatly. If I had to choose, my practice is in general psychiatry. I also do a lot of substance abuse. But if I had to choose an area that I would probably navigate towards, it would be PTSD. And maybe that's because it encompasses everything. But I also very much enjoy ADHD, and I also enjoy treating traumatic brain injury. And a lot of these people that have traumatic brain injury will be related to the PTSD. That's probably where it started. I would like to develop a system where I can post certain videos about mental health, about psychiatry, about psychotherapy that may help people, and may help people realize what they need and where they need to go and how they can get help, and yes, they can get help. It's out there. I'm also hoping that when I look at this COVID-19 and this coronavirus, maybe, just maybe, it'll enhance the mental health systems in this country and in this world that is much needed. Being very interested in swimming, I follow a lot of the swimming websites, and a lot of the professional swimmers, especially those who have been subject to depression and anxiety, they are coming together to help other athletes in these areas, and I think that's fabulous. They need to do this because they are affected by this in their own way. With the Olympic Games being postponed, with Olympic trials being postponed, with these people who right now should be swimming 12, 14, 16,000 yards a day, training 6, 7, 8 hours a day, they are not doing anything because they cannot, because the pools are closed. This is a major life adjustment, the same as how everybody's an adjustment, staying home. Thankfully, I'm able to do telemedicine or telepsych with my patients at this particular time. My practice, in fact, right now is 100% telepsych. And it's difficult because I notice this, the patients are very needy right now, more so than normal, mainly based on the uncertainty of the outcome of this virus. I sit there and I tell them that I believe everything is going to be okay, because I do believe that. And I tell them that, I just don't know when. But I've noticed over the last few weeks that, and if I have a patient that not only is struggling with the uncertainty, for example, I have a patient who just discovered that her husband has advanced metastatic cancer. So you throw that in to the fact that we're dealing with COVID-19, and due to the fact that she has severe other issues from the past, everything is expounded. We have to deal with this. We have to face this. And this is just one patient in one practice, in one state, in one country. When you look at how exponentially this can be compounded, it is pretty overwhelming. That's why we need to jump onto this and get this allotted and get this taken care of now. Why did I choose psychiatry? I often have patients ask me that, and I don't know. I think psychiatry chose me. The psychiatrist that I trained with 11 years ago, he asked me once, we were talking about my swimming, and he asked me why I chose swimming. And my response to him was, I didn't choose swimming, swimming chose me. The same as psychiatry. I was going to do acute care, I was going to do family practice, and I was actually in that program. And the head of our psychiatric department came to talk to me, and she said to me, she asked me if I'd ever thought about psychiatry, and I had. I'd always been very interested in it. So she said, try it. Let's develop a class, let's develop an independent study and have you look at it. So we did that. And I did some hours with a psychiatrist. I was working at DOC at the time. And I worked with a fabulous psychiatrist who was head of psychiatry at the time. He taught me a lot, as did the psychiatrist who I trained with eventually when I chose psychiatry. And I realized, I remember coming home and saying to my wife, wow, this is it. This is me. This is for me. This is what I'm going to do. This is what's needed. And there it was. I love general psychiatry. And I love the fact that every single patient is different. I wish I could jump on a plane right now and go over to New York City and start treating these people. I cannot do that because I have the patients here. That's the difficult part of this. Another thing that I'm going to do, that I'm thinking of doing, is posting videos to try to help people to reach these areas. It's funny how things happen to you in your life. About 10 years ago, and this is related to psychiatry, I probably just graduated, maybe it was even before that. I don't know exactly when this happened. But every Monday and every Friday, I would start posting, texting, certain inspirations to people. I would look up quotes. I would look up song lyrics. I would look up movie lines, or I'd be watching a movie and something would come to me, and I would post that along with how that particular quote or direction related to what was happening in the world today. These things became very popular. And I realized how popular they became because people started asking me where they were. For example, if it was a Monday morning and I hadn't had time to do it, people would start texting me and asking me if I was all right and where was today's message. So I started doing it on a Monday morning to start the week, and then I started doing it on a Friday to end the week and to welcome the weekend. I'm going to continue to do those, and I thought of doing them to reach a wider audience. I actually have a channel. My channel and my name is Inspiration Points 2020, and I'm going to start using that. Again, to try to reach more people. For example, the message that I have that I'm working on is related directly to COVID-19, and this is what it's been for the last few weeks, maybe even the last month. This is what interests me, being able to educate people and to be able to help people overcome these issues, because I see it as being a snowball that is going to grow in momentum, and people are going to need serious help. I enjoy treating veterans, both men and women, and I have quite a large portion of my patient population are veterans. And I see veterans, and I have veterans from Vietnam all the way through Desert Storm, all the way through current Afghanistan and Iraq. Some of them are still active and ranging in ages from 20s to up into their 70s. And a lot of these people need serious care. I find that the VA is so inundated that their intentions are excellent, but they don't know which direction to go. There are good medications out there to work. Most of my patient population are the underprivileged, and I choose to treat that patient population. That is what I enjoy treating. Most of my patients are Medicaid, Medicare, TRICARE, the veterans, the VA system. And I believe that these people, these folks deserve the best care that anybody can give and anybody can help. To me, I see the healthcare workers and the first responders now as I see the veterans, because these people are so working their roles right now as the military does and as the servicemen and servicewomen do. They don't realize until after the fact what is going on. I welcome you to these broadcasts, I could call them. I'm not even sure what to call them. We just threw this together. It's a Sunday afternoon. My wife and I said, let's just do this. My wife is an integral part of my practice. And my little boys have been involved too. My little boys were telling me about this YouTube thing. The only thing I've ever watched on YouTube is how to do stretch cords and swimming, or some swimming races that I want to watch. But my little boys tell me, you've got to do this YouTube thing. And I've got something very funny that I'm going to share with you to finish this broadcast, because my little boy is 7 and he just brought me this thing. And he brought me these little things. He said, tell them it's all good, and if you like it and if it's all good, they must say so. And then he said, they must subscribe. I presume that means subscribe. And then this is the best part of it all. They must tell them if they like thumbs up. So I think this is something that I'm going to always keep. Thank you for your time. Thank you for your attention. Please let's try to help these people because they need help desperately. Thank you.